A silent threat. Understanding toxic shock syndrome. Toxic shock syndrome, or TSS, is a rare but serious illness. It affects multiple organ systems. TSS is caused by toxins produced by certain bacteria. These bacteria are commonly found in the environment. They usually don't cause harm. However, under certain conditions, they can multiply rapidly. This leads to the production of dangerous toxins. TSS was first recognized in the 1970s. It was linked to the use of superabsorbent tampons. These tampons created an environment conducive to bacterial growth. This led to an increase in TSS cases among young women. Though initially linked to tampon use, TSS can affect anyone. Men, children, and women of all ages can develop this condition. Recognizing the symptoms of TSS is crucial. Early diagnosis and treatment are essential for a positive outcome. Understanding the causes, symptoms, and prevention of TSS is vital for protecting ourselves and our loved ones. The culprits, bacteria behind toxic shock. Two main types of bacteria cause TSS, Staphylococcus aureus, and Streptococcus pyogenes. Staphylococcus aureus is the more common culprit. It is found on the skin and in the nose of many healthy individuals. Streptococcus pyogenes, also known as Group A Streptococcus, can cause a range of infections. These include strep throat and scarlet fever. These bacteria produce toxins that trigger an excessive immune response in the body. This leads to a cascade of events that damage tissues and organs. The toxins released by these bacteria are called superantigens. They overstimulate the immune system. This causes a massive inflammatory response throughout the body. Understanding the role of these bacteria is essential for developing effective prevention and treatment strategies. TSS. A cascade of complications. The toxins released by the bacteria in TSS don't directly damage the organs. Instead, they cause an overreaction of the body's immune system. This immune response leads to widespread inflammation and damage. Imagine your immune system as an army. When it encounters a threat, it sends out soldiers or immune cells to fight it. In TSS, the toxins act like false alarms. They make the immune system believe the body is under attack. This triggers a massive deployment of immune cells. These cells release chemicals that cause inflammation. This inflammation damages tissues and organs throughout the body. This overwhelming immune response can lead to a rapid drop in blood pressure, known as shock. It can also cause organ failure and, in severe cases, death.
Dr. Valentino, to the OR, please.
Section 4. Recognizing the warning signs. Symptoms of toxic shock. TSS often presents with a sudden onset of flu-like symptoms. These include high fever, chills, muscle aches, and headache. Other common symptoms include nausea, vomiting, and diarrhea. As the condition progresses, a characteristic rash may appear. This rash resembles a sunburn and can cover large areas of the body. In addition to these symptoms, people with TSS may experience confusion, dizziness, and low blood pressure. These are signs of shock and require immediate medical attention. It's important to note that not everyone with TSS will experience all of these symptoms. However, if you experience a sudden onset of high fever, rash, and any other concerning symptoms, seek medical help immediately. Section 5. Diagnosis and treatment combating TSS. Diagnosing TSS can be challenging as the symptoms often mimic other conditions. Doctors rely on a combination of physical examination, medical history, and laboratory tests to make a diagnosis. They will look for the characteristic symptoms of TSS, such as high fever, rash, and low blood pressure. Blood tests can help identify the presence of bacteria or toxins. Culturing samples from the infected site, such as a wound or surgical incision, can also aid in diagnosis. Treatment for TSS typically involves hospitalization and intensive care. Intravenous fluids and medications are given to stabilize blood pressure and support organ function. Antibiotics are prescribed to eliminate the bacteria causing the infection. In some cases, medications to suppress the immune system may be necessary to control the overwhelming inflammatory response.